we're going to talk about some fringe or on the edge of what can happen regarding COVID-19. Again, the vast majority of these children are safe, and it is a asymptomatic or mild illness, and you have a higher chance of getting struck by lightning than you do with children being infected with COVID-19. Now everybody's going to say, but what if? And we're going to talk about it, and it is severe, and there are some things going on. So what is PMIS, or Pediatric Multi-Inflammatory System, or syndrome, basically? And what it is, it's a Kawasaki-like syndrome. Now, I've treated hundreds, possibly even thousands of kids with Kawasaki's, both in my training and residency and here at Senior River Health System and beyond. Kawasaki's disease is a disease that is a vasculitis, basically where it causes a global inflammatory process and affects the heart and the blood vessels and causes some symptoms. Now, most of the time, regular Kawasaki's disease is pretty simple to treat. You know, these kids are sick, they are, but they get better. A little bit of IVIG, which is a special kind of a blood product, plus some aspirin and possibly steroids given if that's applicable, and they do well. All right. What is different about COVID-19 and this PMIS, or this Kawasaki-like inflammatory syndrome, is it's a lot more severe. And the way these kids are presenting they're presenting with like toxic shock or bad blood pressure, heart problems. And what this is it's, I want people to understand that globally, for you to understand and to look some things up, is it acts like Kawasaki's disease. Now, the way that we describe or discuss Kawasaki's disease is a mnemonic that I even still use back in medical school called crash and burn, which means burn talks about the fever, and usually it's a very high fever, 102, 103 fever for 2 to 5 days, and usually 5 days or longer. And then the crash mnemonic, the C stands for conjunctivitis. Bilateral, usually meaning that you have wet, watery, injected or swollen eyes, okay? R stands for the rash. So it's a rash of the hands and feet, rash of the chest. It kind of looks like sandpaper rash. It can be very nondescript, okay? The A stands for adenopathy, which means these little balls or lymph nodes, especially in the back of our neck, they get big. And usually it's unilateral or one-sided, okay? It can be both, but usually it's one-sided. S is strawberry tongue. All right, when the strawberry tongue, it gets really inflamed, looks like a little strawberry, that's a big one. And then the last one is swelling of the hands and feet and peeling of the hands and feet and the genital area, or denuding of the skin there. So if you see these symptoms, it's very imperative that you go see to the ER or go to your pediatrician immediately, okay? Now, talking about the correlation between this syndrome is they are seeing some correlates of COVID-19 positive kids having this more reactive issue with Kawasaki's disease. Now, this pediatric inflammatory response causes global inflammation. We don't exactly know what the cause is, except for it causes vasculitis as a trigger of this virus. And particularly, like in Kawasaki's disease, it can cause swelling of the coronary arteries. It's just another vessel in your body, right? And that's what vasculitis is swelling of these vasculatures. But when the vessels get inflamed, like in the heart, that's dangerous, and that's why you get the aspirin and IVIG for regular Kawasaki's. The danger with this PMIS, or Pediatric Multi-Inflammatory Syndrome, is that this is presenting with more cardiac toxicity, meaning more cardiac damage. So the vessels are more inflamed and they're a lot sicker, okay? So it looks like they have high inflammatory markers. It can look like some bacterial illnesses like staph, for example. So the point is the differential is vast, okay? We are trained down here to see it. We have seen it. And like I said, typical Kawasaki's, I could look at you and say, as a hospitalist, I've treated thousands and will continue to treat them safely here. But with Kawasaki's like syndrome that's seen in COVID-19, they usually need ICUs. Now, of all these cases, as of right now, and there's over 40 that we're seeing in National Children's, okay, and the PICUs there that we've talked to and seen some studies, all right, all those kids have recovered, all these children have recovered thus far, all right. There's always gonna be outliers, and that breaks our hearts, but these kids do recover, and this syndrome usually is recoverable and very easily treatable in the long run. Like I said, having cerebral palsy, going through medical things with myself, I know how you feel and mean it. So don't take this lightly by any means, but know that it is treatable, but it's something you need to be very careful of and look for these symptoms and see your pediatricians immediately.
Should families, be fearful of sending their kids to summer camps and getting them involved so that people can go back to work?
No, they should not. Okay, this is exceedingly rare. Like I said, it's more likely you're going to get struck by lightning than you would to see this PMIS in your kids. So no, by no means would I tell you to stop letting your children be in summer camps. Still good social distancing, washing your hands, that's important, all right? But by no means do you have to stop life and worry that this will happen to your child, by no means. So still, go to your summer camps, have a great summer, go to your families, go to the beaches, things like that. But again, good hand washing, just like any other viral illness, just like as we go into flu season in September and October, the same kind of thing. So no, don't let fear grip your life. Combat that with the facts, and I'm trying to give you some of those there. So don't let that completely cripple you. Be safe, be informed, wash your hands. So eventually, this is going to be, again, give me some grace because it's very fluid, okay? We still have a lot to learn about COVID-19 in terms of, what we're looking at in terms of preventative component, meaning that are the plasma. So far, it's showing that the plasma of the infected are showing lasting immunologic positive effects to the uninfected or the infected that we're trying to treat, meaning that a vaccine will be developed eventually. So it is going to help. Now, eventually we will find a way to combat this in the form of serology, immunology, and vaccines when they're tested appropriately and vetted that way. So yes, it is going to, as of right now, studies are I'm cautiously optimistic that we will see a vaccine that's going to provide a cure in this respect. So even in the midst of this pandemic, it's important to still see your pediatricians and your healthcare providers for all the regulatory needs, the health checks, the screenings, right? We check your eyes, hearing, all those things as well. Plus meningitis vaccines for the kids that's going into high school, into college, still very important. Flu vaccines, right? DTaP, diphtherias, tetanuses, these kind of things when kids are in the playground, they hit a rusty nail. That's where your tetanus comes in. Pertussis is a type of whooping cough or a type of cough that you can get. So these are still important vaccines that we provide in our clinics that have been proven safe and effective, and that they're still around to get your kids ready for school. So come see your pediatricians for your well child checks, for your sports physicals, and get prepared for a great new year in school. And like I said, I have a kindergartner. All right, I would do nothing to your child that I wouldn't do to my own daughter, and I'm expecting a boy on the way as well. So I don't just practice what I preach, I do it, I live it, and we know that they're here to help you, and we want to be a part of your care and give you an exceptional peace experience. And I thank you for allowing us to be a part of that care, both inpatient, outpatient, and whatever it looks like. Thank you for letting us take care of that most precious gift that you have, and that is your kids and your family. So thank you very much. I appreciate the fear and I understand how they feel, but I also will tell you that when you're in the hospital, this is one of the safest places you can be, because we are actively disinfecting everything, right? The hospital is on high alert in terms of washing everything down. EVS guys are walking all over the place. My girls, myself, we're always wearing masks, right? We're wearing gloves, those kind of things, always washing things down as appropriate with guidelines, and that doesn't change in the long run. All this has done has made us even more aggressive. So I want to tell you, we've been doing that before all this. Sometimes I tell people, and I hope you guys will smile, we're talking about washing our hands, and that's something new? No, it shouldn't be. We should be washing our hands, we should be covering our faces when we cough, those kind of things, and we're still doing that here. We're washing our hands, we are sanitizing our exam rooms and our hospital, and so I can rest assured you to tell you this, you're safer here coming to see your doctors than you are walking in Walmart, Lowe's, or these other places for other needs that you need. So please let that know, that put the doctors on your list, just like the essentials are Walmart, Lowe's, and all those other places. Know that the doctor has you protected, and these clinics are doing what they can to continue to stop the spread of all pediatric diseases of any time. I can give you a bunch: adenovirus, bocavirus, flu, right? I can give you tons and tons of the same ones that we're going to walk into during this winter that we're going to be prepared for, to serve and to protect your kids from.